What the? Come on. What is this? I'm not even 2 seconds in and I see a shark flailing on a roller coaster. The Shallows, Jaws, and even Sharknado. Holy sardines, Batman. In honor of Shark Week, today we're breaking down and reacting to all of these survival medical scenes and intense injuries from all the popular shark encounters from some of your favorite movies. Let's dive right in. Oh no. Oh! Come on. What? I think this is based on a true story. About a professional surfer, Bethany Hamilton, where she got her arm bitten so severely that the arm needed to be amputated. Wow, look at all that blood in the water. Is the salt water something that is helpful or not? Maybe if it was like pure salt water, because normal saline is actually salt water, that's quite sterile. Here, you have the ocean. It's filled with different bacteria in it and microorganisms in there. So it does increase your risk of actually potentially getting an infection.
On the board, keep on the board. Byron, you get the shore. Go, call 911.
Okay, oh wow, okay. Kind of did a little bit of first aid, meaning putting a shirt on to try to stop the bleeding, but this is most likely just collecting the blood. What do you need to do? Start with pressure to the wound. Let's see what they do. I think it's actually quite smart to have the individual not looking at the arm, because that would increase heart rate, which then increasing heart rate, blood pressure will then increase the pumping of more blood out. Using the cord of the surfboard itself as a potential tourniquet, which is great. You want to do it proximal. She's getting tired and a little sleepy. That's definitely related to blood loss. And what it could also be related to is the decreasing surge of the epinephrine. So you have the big surge and then all of a sudden it's kind of calmed down because the situation has changed a little bit. So you're not continuously in this fight or flight. They're using the board as like a stretcher, totally appropriate. Instead of trying to lift this patient, use your forces that you have to get the person off the beach and to help as quick as possible with the least amount of movement.
She's going into hypovolemic shock. We're almost there.
Going to hypovolemic shock, when somebody starts becoming altered, you're lost about 30% of your blood volume. Typically, people have around 10 pints of blood or so 30% of that you've lost. When you lose it that fast, you start having a significant amount of symptoms. So disturbing. Oh my gosh. Wow. Oh man. When you're getting bitten, are you being dragged under the water and drowning? So that's something to be concerned about. They do a pretty good job of depicting what a limb would look like in water. Wow. Many people's fears and phobias relating to sharks literally came out of this movie. They just depicted the shark as massive and really aggressive towards human beings, which is typically not normal. Shark attacks are actually quite rare. What the? Come on. What is this? I'm not even 2 seconds in and I see a shark flailing on a roller coaster. This guy is getting bitten on the right flank of the body. Obviously, you have your lung, your ribs, but then you get to your liver and then the intestines on that right side. What is happening?
What is happening?
If you're like me and you're feeling a little perplexed and stressed about watching these intense shark attack scenes, you can always check out and try this. Chillax by my company, Life Happens, for the occasional stress support. Oh, nice. Okay. That looks fun. Oh, no. Look at that. That is so scary. Crazy. Wow, okay. The board and the fins are bright yellow. We're told to avoid things that are really bright in colors. The contrast could affect the sharks if they're in the area. Oh, hit the reef. Oh! Reef meaning potential rocks and coral, super sharp, painful, getting knocked off the wave. The wave underneath still is turning, so causing it almost like a bad washing machine event. Oh, like dislocated shoulder, fractured clavicle, abrasions. Obviously, if there's like blood in the water, that potentially will signal to sharks because they have the very good sense of smell. And so they can actually smell blood in the water. Oh, that's definitely a shark biting her. Oh my gosh. Oh! The crunching noise of this show just makes me just cringe. But you can see the blood is surrounding her all in the water. It's obviously depicted as a ton. It is a decent amount of blood, but it's even worse because it's in the water. So legs are in. Oh my gosh, it's not a rock, that's a dead animal or something. I don't know what she just climbed onto, but it's got flesh and blood. Don't know if it was a shark that bit her or something else that's potentially dead in the water, but getting out of the water by any means possible, yes, just do that. Oh my gosh. Ah, bit in the left leg. Bad puncture wound, good depiction, left thigh. The major vessels run near the bone itself, mid-thigh, so that's potentially good, but destruction of tissue, increased risk of infection because of puncture wounds, and then obviously a bleeding component. So using the cord as a tourniquet to decrease the blood loss. Using a tourniquet and actually strapping it down super tight, if possible, causes significant amount of pain. Not just from the compression of the tissue, but also because you're now decreasing the blood going to the tissue, which will cause pain to the distal part of where that tourniquet is.
Mike, stop messing around.
Oh, shiny.
Mike! Richard! Mike! Mike! Something's got me, Richard! Mike! Pull me out!
Didn't know if it was painful or not. Something's got me. You haven't registered the bite yet or the pain. That's just our body's normal mechanism. Oh. Oh my gosh! The arm just came flying off.
Oh my god, this guy's arm just came off.
Obviously, it doesn't make sense anatomically that the arm just came off when the shark was biting the lower half of the body. They typically don't just come flying off. It takes a lot of force. Stop it. The electricity, either AC or DC, depends on the type of current that is there, will cause cardiac arrhythmia, send your heart into an abnormal rhythm, and then decrease the output of your heart, either by not functioning or actually shutting off the electricity of your heart altogether. What is this? Holy old school Batman. Stop it. This shark is latched on. It's almost like an alligator crocodile type thing too, where it's just this massive jaw that's just now clamped down and not letting go.
Hand me down the shark repellent bat spray.
Oh my gosh, the shark repellent spray. There are actually shark repellents out there. There are sprays, there are suits out there that you can wear, and there's actually even like electronic devices that you can use to deter sharks away from you. Oh my gosh, it's almost like a mace. Maybe even back then, Batman's suit might be made of repellent or special material to prevent it from being gashed or like punctured into. These shows definitely make sharks a little bit scary. We're talking about shark attacks and injuries related to it, but remember, they're very rare and that sharks are actually quite important. They're part of our ecosystem. If you guys enjoyed this, definitely check out this series right here, binge watch everything, and please do me a favor, subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.